Hi, Miss Jones. My name is Alexis. I'm going to be taking care of you today. So can you state your name and date of birth? Okay, thank you. And so I've already checked the orders, and today we are going to be doing a wound dressing for you. I've already gathered all my supplies and applied pain reducing interventions. So I'm going to put gloves on. I'm going to take the waterproof pad and place it underneath the wound. So I'm going to use the push-pull method to remove the dressing. And I'm going to check the dressing for any drainage, blood, and I'm going to note the color, the odor, and the amount, and the type of it. So right now there is no drainage on the dressing, so I'm going to throw that away. And then I'm going to take my Q-tips and I'm going to measure the wound. So you're going from the longest point across to measure the length, which is 11 centimeters. And then you will go from the highest point of the wound, and it is 2 centimeters. And to measure the depth, you would go to the deepest part and carefully measure it, make sure not to poke your patient. And then it's 1 centimeter. So now I can discard of that. And I'm going to remove my gloves. And now I'm going to perform hand hygiene. And I am now going to set up my sterile field. And I already have placed my tape out. You want to make sure you only touch the outer 1 inch border. Set that down. And now I can open all my supplies, making to say 6 inches above the sterile field. And this I'm going to take and place underneath the wound to collect drainage. And now I can take my solution, check the expiration date and the last time it's used, and since it was open, I would lip it, and then I'd pour that into the solution and onto the gauze to make it wet. And now I'm going to put my sterile gloves on. Making sure that the arrow is pointed down. And I can discard of that. So now that everything is sterile, I can set everything up. Don't need that. So the first thing that I'm going to do is take my syringe and fill it with my solution. And I'm going to, with my non-dominant hand, I'm going to hold the tray. I'm going to irrigate the wound 1 inch above it, letting the solution drain. And then if there was still drainage, if the solution wasn't running clear, I would do it again. And now that the wound is clean, I can put that back in there. And I can take dry gauze and dab around the wound. And now I'm going to take a cotton swab, transfer it to my non-dominant hand, and take the wet gauze and use it to pack my wound, making sure not to touch the cotton swab because it is in my clean hand. And now that the gauze is packed, I will take 2 pieces of gauze and put them on top. And then I will take my abdominal pad and place that on top. And then I will grab my tape and then with my short piece, I will write my name and the date and time and put it on the middle of the abdominal pad. And now that the dressing is covered, I can discard of all of my equipment, remove my sterile gloves, perform hand hygiene, make sure that Mrs. Jones is comfortable, and I would lower the bed.